It begins with a process known as apoptosis, or programmed cell death. This process occurs in all multicellular organisms and essentially involves cells destroying themselves in order to facilitate various biological changes throughout the body. However, sometimes this process is ineffective and fails to remove the tiny fragments that are produced during the destruction of a cell. These fragments merge into compounds and are released into the bloodstream, exposing the immune system to substances that are normally found inside cells. The compounds that form are known as anti-neutrophil cytoplasm antibodies, or ANCAs for short. And unlike normal antibodies, these target harmless proteins produced by the body. The major target for ANCAs is the protein known as proteinase 3, which is a serine protease enzyme found in white blood cells. The release of this enzyme results in the acute inflammation of blood vessels known as vasculitis, which it achieves by inactivating anti-inflammatory granulin. The inflammation reduces the amount of oxygen in the blood and restricts blood flow to the organs supplied by these inflamed vessels, preventing them from receiving enough blood to function effectively and resulting in the destruction of tissue. The primary organ system affected by the disease is what is known as the upper respiratory tract, which refers to the airway above the glottis or vocal cords. Those affected can experience moderate to extreme sinus pain and nose bleeding, as well as the appearance of nasal ulcers. One of the most common indications of the onset of Wegener's granulomatosis is persistent rhinorrhea, which refers to the cold symptoms of constant nasal discharge resulting from nasal inflammation. Holes can then develop in the nasal septum, and this may lead to a collapse of the nasal bridge, causing facial deformity. Blockage of the auditory tube may result in severe infections and permanent hearing loss. Loss of vision, and what are known as pseudotumors, can form in the eyes as well as a range of other infections including scleritis, conjunctivitis, uveitis, and episcleritis. Rashes and lesions develop all over the skin, as well as in the lungs, which can cause acute bleeding from the lung. Chronic renal failure can occur in the kidneys if the disease is not treated in the early stages.